Whether you have been on Medicare for years or you're just researching your first time coming onto Medicare, purchasing your prescription drug coverage can be pretty confusing. And during this time of year, specifically October, you are going to be bombarded with advertisements on TV, radio, flyers in your mail. So be ready. We're here to help. I'm going to answer any and all questions that we can get you to the finish line for your prescription drug coverage. I am required to let you know that we do not offer every plan in your area. Currently, we represent 8 different organizations, which offers 107 different plans across the state of Washington. If you are interested in finding out every plan available in the state, you can contact Medicare.gov, call 1-800-MEDICARE, or contact your local state health insurance program to get information on all your options. There you've heard our lovely disclaimer. Now let's get into it. For those of you who haven't met me or don't know me, my name is James, owner of Castell Insurance here in Sequim, Washington. And we're going to be walking through our very own shopping tool to help you look, review, find out what coverage plan is going to be best for you for next year. So I'm going to go ahead and shrink myself out and get down to the fun stuff of the presentation. We have our very own tool that allows you on the consumer side to do your very own prescription drug review. That is called Clallam Part D. So we've got our own website. We're going to type it in, ClallamPartD.com, and we will bring up the site to show you everything you need to know, where you need to be looking, and what you need to find. So when you come to our very own shopping tool, you will see right up here in the top corner the agent name Castell. So you'll see our logo, you'll see our name. This way you know that you're dealing with a trusted site. We're going to advise that all of you that are going to come back to this site each and every year, it's going to make sense for you to set up your own username and password. So clicking on this log in, if you've been here in the years past, you should be able to log back in. If you've not, you can create your own account. Now the benefits, why we recommend this, are it's going to keep any of your information. So if you enter your prescription drugs, when you have your own account, it will store that information for next year. That's going to simplify the process year in and year out. With new regulations and new security protocols, this type of shopping tool is not going away. If anything, it'll be utilized even more. So saving time for you next year is going to be great. Also, the main benefit is if you set up a username and password, you can still contact our agency and ask us to pull up your account. Once you've done it on your end, we can actually pull up and see exactly line by line what you have been entering, and that way any of our agents in-house can actually still help you answer questions. We're going to jump right in. For some of you, you've seen this in the past. For those who haven't, we're going to still walk through step by step, but I'm going to go ahead and enter in the most common zip code in our area, Sequim. We're going to choose the county in which we're in, and it's going to show us the plans. Now this is just going to show us plans simply ranked currently off of the premium. So most people, they generally razor in and say, how much is the plan going to cost? How much is the plan going to cost? And that's what we're here to help you find out. But it's really, the plan's only as good as the prescription needs each individual has. That's why it's super important for you to go through each year and just re-enter your prescriptions. If you've changed dosages, if you've changed from a brand name to a generic, these equations will change. As you can see, we're shopping for 2024 plans. Your deadline to do so is December 7th, so you have time. If you're watching this prior to that, you have plenty of time. The way that we personalize it is by adding preferences here. Again, once you've set up a username and password, these preferences will be stored. But the big two that we're going to do is these last two, prescriptions and pharmacies. Not so important for you to go through and give them your general health status or your providers. What we're here for using this tool is to look for prescription drugs. So we've gone ahead and decided to do a few of the more common drugs. What you'll notice is this awesome pre-filled function. It's pulling from Medicare's database. So even if you don't remember the exact spelling of all your prescriptions or how they sound, if you just start typing in a little bit, it's going to pre-fill. And then along with that pre-fill status, it's going to give you the most common dosage and frequency for every prescription. So pay attention, because what it pre-fills, it might not be what you take. The next drug that we'll look at, I'll show you that, but this is one of the common albuterol inhalers that we will go ahead and add to our personal formulary. The next we're going to do is a lisinopril. And take a look, when we type in the lisinopril, it's going to automate to 10 milligrams. So that's saying 10 milligrams, 30 per month or 1 per day. So this is giving you the most common. Very rarely you may need to change this. And oftentimes for most prescriptions, it doesn't make a tremendous difference, but we have seen on 1 or 2 where the dosage can make a big difference on the cost and the recommended pharmacy. So we advise you take your time, go through. We'll all be here to help answer questions, but you want to make sure that you're entering your specific prescriptions. The pre-fill is great, but make sure you pay attention that it is specific to you. Now, atorvastatin will go ahead, and just for fun, I'm going to change it and say I need a little bit of a higher dose at 40 milligrams, and we will add. Now, for those of you who take no prescriptions and you're just looking to have a prescription drug plan just to avoid any sort of penalty or be in the game, as we call it, you don't have to go through entering prescriptions if you don't have any. And choosing which pharmacy is not super important, again, if you don't take anything. So it's really important. The more things you take, the more you're going to want to focus on all of this information. Now, when we continue on, you can continue or click pharmacy here. We'll just go continue. This is important because a lot of these big prescription drug providers are starting to really partner with pharmacies. You'll see some of them actually have the name of the pharmacy in the program. So you'll see, I believe one is the Humana Walmart. I believe there's a United Healthcare Walgreens plan. Now, that doesn't mean that you have to go there, but what that means is you will get preferred pricing by going to those pharmacies. So you always have the choice of going wherever you want. It's just going to cause the pricing to fluctuate. So what I'm going to do is go ahead and select some of the most popular pharmacies we see in our area. A lot of people like Costco. We'll do Walmart and Walgreens because those two have drive-ins and seem to be open late. And then you can change as primary, but it's important. I always like to have people check more than one. Choose your preferred, choose who you really want to go to. But at the end of the day, if your prescriptions, if it was half cost to go somewhere, maybe you would be a little less allegiant to the one brand. So now what the system has done, that's it. It's done all the heavy lifting. It has run your 3 prescriptions through each one of the plan's formularies, and it's crunched the numbers for you. So first and foremost, what we're looking at, estimated cost based on Costco. So we selected Costco as our primary, and as you can see, it's very easy for us to change which pharmacy we're looking at. If you notice, this number here, this is what everything's being ranked on. So Costco, they estimate these prescriptions will cost you $405 throughout the year. If you were to go to Walgreens, $309. So about $100 savings. Most people that I encounter and we talk to in a given year, $100, you're not going to change pharmacies over. Not many people are going to go chasing the bottom dollar for, $8, $10 a month. Now, if this was, a $500 savings, maybe you'd think about it. But for now, what we're going to do is we're going to go forward with the Costco pharmacy like we talked about, and then we will show you what the plan is looking at. This is always going to be ranked based on your total annual estimated cost. Now, what that means is they are combining the cost of the plan, so this is the monthly premium, how much the insurance will cost, and then the cost of the prescriptions. So those numbers can be different. Obviously, the more that you're paying for your plan, sometimes that means lower cost in prescriptions. Let's just scroll down here and see. Doesn't really look like it. Oh, here we go. Here's a plan, if you want, that they would cover all 3 of those prescriptions at no cost. So that means on this Aetna Silver Script plan, you'd have 0 co-pays for your prescriptions. However, you're going to pay $90 a month for that. So the difference is pretty drastic because you're falling in love with this low co-pays, but you're paying a ton more on the premium. And that gets you at a much higher annual estimated cost. So what this system does is it helps kind of prioritize based on your prescriptions how much they think you're going to pay. Now, big thing we're going to look here is these all have green check marks. These are some more of the common run-of-the-mill prescriptions, so they're all going to be covered. If you see a prescription that's grayed out, that has like an X next to it or no green check mark, that means that that is not covered by the plan and obviously will have a tremendous impact on your costs. One really cool way to look at things, if you wish, you can check on the plan details. So I'm just going to focus on this WellCare plan because this is what came up as the best for this 3 prescription need. If you click on plan details, it's going to show us how much you're going to pay each month, how much you'll pay throughout the year, that you have a deductible, So what that means is if you have higher cost drugs that are listed on tier 3 through 6, then this deductible applies. If you have low cost or what's called generic prescriptions, there's no deductible. So that means you're going to get coverage right away. So on those lower cost, more traditional drugs, you're going to have no deductible. You'll get coverage. Once you get into tiers 3 and higher, you're looking at maybe paying some percentage of the prescriptions. Pretty standard. But what I really like to do when we want to look at things is if we scroll a little bit further up, is if you go to prescriptions, this is going to tell us what each prescription costs. So you'll see that most of these, the atorvastatin and the lisinopril, very, very low cost on retail, and on the albuterol, moderate cost. But the big one that I like to look at is this total estimated cost. This tells you what you can expect to pay each and every month. So this is showing as of January, you can pay $33.74. That just means that you're chipping away at that deductible. So you'll see here lisinopril and atorvastatin, both of those are coming to you at no cost. This plan would cover them in full. And then the inhaler here is going to cost $33. This helps you get an idea as to what your expected costs will be throughout the year. And if there's ever something called the donut hole, which some people are familiar with, where your costs will jump up. With Medicare prescription drug coverage, if you have higher cost prescriptions, you're going to meet that deductible pretty early, and then you're going to get a lot of good coverage through the middle months of the year, and then you may experience something called the donut hole, where after month 6, 7, 8, 9, somewhere in that range, you may be asked to pay a higher percentage once you've exhausted the base policy. So a lot of details here. This is why we always preface that it's important for you guys to set up your username, set up your password. That way, if you do have questions, you can reach out to us. We're more than happy to pull up your account and look at what has been entered, and we can walk you through it. But all in all, if this is the right plan for you, this is where the website becomes a really cool tool. Just like when you're shopping on Amazon, you will add this to your cart. It will then ask, we are taking you over to the WellCare plan site. So I'm going to go ahead and follow that, continue to apply. And since we are a little bit early, you can't do the shopping, but what would happen is it's going to say, we're taking you to WellCare, and it's still going to keep our Castell name on here. That means you still get our service, our help and advice throughout the year, but it's going to take you straight over to their website where you can enter your own information, your Medicare number, your date of birth, how you'd like to pay. You'll usually have a choice between your checking account, your Social Security, or your bank account. And when you enroll in the plan, that's it. Not only will you enroll in the new WellCare plan for next year, but that process will automatically cancel your prior plan. So there's no way that you can have two prescription drug plans. By enrolling in the new plan, it will automatically cancel the other. Now, what we may see questions, most of these plans change very little bit each year. They may go up or down a few bucks and change some of the copays a bit. What you will see, some of you may find out, hey, I was on this Mutual of Omaha Essential plan last year and it worked for me, and now it's 23 bucks and it shows to be a good plan for me. If that plan is what you're already on, shows up as one of the top 1 or 2 plans, and that's what you want to stay with, you don't have to do anything. You don't have to add to cart. You don't have to re-enroll. Your plan will renew for next year if it's on here. So if you go through this whole process and you find out, hey, great, WellCare value script, that's what I have, that's what I want, there's nothing you need to do. So there's no point for you to go through a full re-enrollment and apply for a new card, new this, new that, change your payments. If you're already enrolled, your current payments and everything will roll through. Again, this is just a super important exercise to make sure that you are updating your prescriptions. Now, if you find out that you wanted to change a prescription here, you simply go down and go back to edit. So this is going to save all of your information. As long as you've set up that username and password, you're going to go to edit and you're going to add any of these other prescriptions that you may end up needing. So you can add, change. If you say, I'm not too sure I'm going to continue taking that inhaler, it seems really expensive. If you want to find out what the drug costs are without it, you can cancel that off of your formulary, move forward, and it's going to rerun these numbers, as you'll see, in lightning fast time. This is where you're not relying on some old insurance agent with an abacus to do the math for you. The computer does all the heavy lifting. So take your time. We're here to help, handhold, walk you through. If you have questions, make sure you reach out to us. We know that this has become a staple of the open enrollment process for our clients and anyone throughout the country that's on Medicare. But do your homework. We thoroughly encourage everyone, even if you're happy with your plan today, just take the 10 minutes to go through and make sure what you have makes sense for you next year, because if you miss that open enrollment deadline, there's really no get out of jail free card. If you miss it, you're going to be stuck in the plan for the remainder of next year. So again, thank you for watching. If you do have questions, make sure you reach out to us. We're happy to answer any and all questions, but hopefully you found this helpful. Remember, ClallamPartD.com. If you forget that, you can always go directly to our very own website, and you'll see right up top here, we've got our own link to ClallamPartD.com. You click that and it will take you right back to our site, and you'll always know that you're in the friendly confines of a Castle Insurance website when you see the name and the logo up there. So again, wore the logo on the shirt for you guys. Make sure that it's matching up there. If you have any questions, make sure to reach out. Happy hunting, happy reviewing. Make sure you're in a good spot for 2024 and beyond. Thanks for watching.